And my name is Charlie Wallace, and I'm the Scottish Veterans Commissioner. It is hugely important, and it is long awaited. It's something that I've been looking forward to coming to fruition now for about 3 or 4 years. I think it's something along the lines of a blueprint, really, for a better designed and planned mental health and wellbeing services in right across Scotland. I think it's quite ambitious, and the 3 principles really get at the heart of what we need to do to address some of the perceived and actual inequalities for our veterans in Scotland. I think the key difference that we're going to see is that we get a parity of care across Scotland for all of our veterans, irrespective of how they come into the NHS in Scotland. And that, I think, is the most important thing. And if we can get that parity of care and the right amount of support for them, then I think we'll be able to address some of the issues that they might bring to the party more quickly and more readily, and therefore stop some of the longer term issues that might accrue, or which we've seen accrue over the years when that care has not been available at the appropriate moment. The key thing from the report is about the 3 principles. It's about equality of care right across Scotland, wherever you are. It's about getting the appropriate care for the service person, for their particular needs. And perhaps most importantly behind all of this, it's got to be properly resourced within NHS Scotland. I think this report highlights that really well. The action plan highlights that really well. And I really look forward to seeing that parity, appropriateness, and properly resourced support for our veterans community. I think the really important thing is the Scottish Veterans Care Network, which is the fundamental basis across NHS Scotland that helps put veterans at the forefront of people's minds as they wrestle with the challenges that we have in the health service today, especially after COVID. And that Veterans Care Network has got a really important job to do to demystify some of the challenges that people perceive veterans to have, and look at them for the needs that they have, and making sure that they're able to address them as they would for any of the other people who need the services of the NHS. I think the key difference is it's going to be easier for them to get into the NHS for the particular needs that they have. It should give them more reassurance that people will have a better understanding of what those needs are. And they should also be reassured that the NHS in Scotland is appropriately resourced and focused on dealing with the veterans community. I would also like to stress that the veterans are part of our community. They're not something separate. Although they may bring some particularly unique challenges, they are indeed just members of the community. And it's about bringing them into the fold of that community and treating them with the respect and the care that they deserve, especially for those who've been damaged mentally or physically defending our nation.